I was taking a shower and I felt something, and I knew that I hadn't felt that in my body before. It was July 30th, 2020. I remember driving myself to the emergency room after work. So I walked in and I told them, I feel something in my chest, so I would like a doctor to check it out. I'm hoping it's just something simple. The doctor did feel and said, yes, I feel something. You will have to go to radiology and get a mammogram. It wasn't until I walked in that I realized that it's these big equipment that, well, now saved my life. I was diagnosed stage 3, so I had to do a mastectomy, I had to do radiation, I had to do chemo. I'm usually a positive person, so I was like, oh, I'll get through this. But when I had to start chemo, just the first day, I was really not doing well. If maybe it was caught even a little bit sooner, I maybe could have avoided one treatment or maybe all of it with the new technology.
Most patients are coming into the department to have a screening mammogram, and they go into the X-ray room and get their mammogram performed, and then it is digitally sent into our reading station, and then we read them here in this room. The new technology that we are acquiring here at San Mateo Medical Center is called digital breast tomosynthesis, and it essentially acquires a series of slices of images rather than just one two-dimensional image. And we view all of the slices one by one. What it can mean very often is that a breast cancer that wasn't showing up very well on the regular mammogram is allowed to grow to a stage that requires very big surgery, chemotherapy, radiation therapy, and a lot of treatments that are very difficult to endure. If we find something earlier, because we now have this better technology, it also has been shown that many patients can receive much less invasive surgery and sometimes even less treatments like chemotherapy.
I think the humanitarian crisis we're facing nowadays is really access to our clinics and our healthcare system. It's also living in one of the most expensive counties in the country. We are the 4th most expensive county in the country, and we have 77,000 people who need public health care. So we are trying to raise money for 3D mammography. It's an upgrade from our current unit, which is 2D. It is a standard of care in the United States, but it's not the gold standard of care. The gold standard of care is 3D mammography. We want every daughter, mother, husband, whoever comes in for a mammography exam to go home with a peace of mind that they got the right exam done by the best equipment there is out there, and it really will impact a mother coming home with peace of mind, or it'll help us detect that cancer early so that we can get that mother or daughter on the road to recovery quicker. Thank you all for being a part of this, being a part of this community, being a part of our foundation. Our ask is for you to open your hearts tonight, open your wallets tonight. We've all been affected by cancer in some form. Please dig deep and realize how much this impacts our 77,000 patients who come through our doors. And with the new mobile bus, we'll be able to go out into the community. We'll be able to go out to Coastside and Daly City and South City, down to Redwood City, and get all of our patients the proper care that they need in the places that they are.
Just knowing that there's so many more people out there that may not be diagnosed yet and will have the opportunity for these new equipment. I'm so thankful that everyone is here helping. Make sure that you are always aware of your body, and when you know something is wrong, go get checked. The first people at the hospital that I saw after the ER doctor was the radiology department, And for that reason, I want to go back to school and work radiology so I can help patients. I know exactly how it felt to walk into radiology and not know what all these equipment were, and now it saved my life. So I want to go back and help anyone that might be in my shoes.